I'm Dr. James C. Marotta. I'm a dual board certified facial plastic surgeon. I began my education and training. I went to Columbia University. I then went on to medical school at SUNY Stony Brook. I did my head and neck training at Yale University, and then I'm fellowship trained in facial plastic surgery. I'm a facial plastic surgeon, meaning I specialize in facial cosmetic and reconstructive surgery. I'm really mostly 100% cosmetic surgeon at this point. I do a whole range of procedures. One of my focuses is rhinoplasty. I do a lot of rhinoplasty and facelifts. Facelifts, including all facial rejuvenation surgery, upper blepharoplasty, lower blepharoplasty or eyelid lift, fat transfer, cheek implants, chin implants, endoscopic brow lifts, endoscopic mid-face lifts, a whole gamut of cosmetic procedures for facial rejuvenation, as well as facial contouring. I also do a lot of injectable treatments, including Botox, fillers, and facial contouring. I think, if I look at my passion for plastic surgery, it's really with regard to taking care of people. I love seeing patients, the satisfaction on their faces when the cast comes off or when the bandages come off and they feel like a new person. They feel transformed. I feel that power through them. I feel grateful that I'm able to do that. I'm able to be a part of that in some small way. And my intense passion really for caring for those people through that experience, I think that's really what drives me to try to become better and better every day. Most rewarding moments, certainly, certain patients come to mind, certain cases that I've dealt with that were difficult. I had a patient who was missing half of their face from a melanoma, and I had to figure out how to kind of put them back together. I had horrible car accidents where people were missing their eyelashes or eyebrow or had a broken nose, and putting people back together, making them whole again from a horrific experience that they had. I think that's certainly key transformative moments in my practice. But I think also watching or growing my practice from being a sole practitioner. I started a practice just with me and one secretary in a very small office, and I used to clean my own instruments, mop my own floors, and over the years I've grown the practice to being what it is today in a new location with lots of people and lots of new faces and a growing family of people that work here with me. I think it's become a second part of what's made my life special in this career. So we really strive to give people the feeling that they're family when they walk in the door, that we would care for them as if they are a loved one, and I feel that way of every patient that's on the table. If this were my son, or when I see a young kid who's in his teens having rhinoplasty, I think about my son. I think about my mom. When I'm working on somebody who's having facial rejuvenation surgery, and just having that feeling that the person in front of you, it's their day. It may be something that you do every day, but they're that special person there right now, and giving it all you got, really, to give them the best experience and care for them the best way you can, the safest, most effective way to just give them all of us, and all we can. I decided to become a physician. I really kind of bounced around different careers, and I always loved science. I always was fascinated by how things work and why things work the way they did in nature and in the world. And I was really, really good at science. And then I realized that I also wanted to help people. And I thought, well, what better way to do it? Combine a passion for science with ability to help people, and I was hooked. And I don't have anybody in my family who's in medicine. I just thought I would be, I thought it was the career that I wanted to pursue. And I went back after college and then did pre-med classes and went back to school to become a doctor. I didn't know I wanted to be a doctor when I finished college. So. The med spa is really a complement to what we do in surgery. And surgery is, the way that we, transform people. The med spa is the way that we both prevent aging and help people complement people's surgical treatments. So, you know, all the aesthetic treatments that we do, including injectables, and, you know, neurotoxins, fillers, in addition to microneedling with PRP and skin rejuvenation procedures like intense pulse light and non-ablative erbium lasers. And we have all the latest state-of-the-art technology in the med spa that helps people to rejuvenate their skin, to look young, to feel young, and to complement the surgical practice.